Common causes of postmenstrual bleeding.
Hey everyone, welcome back to our channel. Today, we're going to talk about a topic that many women may have experienced or have concerns about, postmenstrual bleeding. In this video, we'll explore the common causes of postmenstrual bleeding and provide you with some helpful information. So, let's get started.
What is postmenstrual bleeding?
Before we dive into the causes, let's quickly clarify what postmenstrual bleeding actually means. Postmenstrual bleeding refers to any vaginal bleeding that occurs after a menstrual period has ended. It's important to note that this is different from intermenstrual bleeding, which is bleeding that occurs between periods. Postmenstrual bleeding typically happens within a week or two after the end of a menstrual cycle.
Hormonal imbalances.
One of the common causes of postmenstrual bleeding is hormonal imbalances. Hormones play a crucial role in regulating the menstrual cycle, and any disruption in their balance can lead to irregular bleeding. Imbalances in estrogen and progesterone levels can cause the uterine lining to shed erratically, resulting in postmenstrual bleeding.
Uterine fibroids.
Uterine fibroids, which are non-cancerous growths in the uterus, can also be a contributing factor to postmenstrual bleeding. These fibroids can cause changes in the uterine lining and lead to irregular bleeding patterns. If you experience postmenstrual bleeding along with symptoms like pelvic pain or heavy menstrual bleeding, it's advisable to consult a healthcare professional for further evaluation.
Polyps.
Another potential cause of postmenstrual bleeding is the presence of uterine polyps. Uterine polyps are small, benign growths that develop on the inner lining of the uterus. They can cause irregular bleeding, including postmenstrual bleeding. If you notice postmenstrual bleeding accompanied by unusual discharge or persistent pelvic pain, it's important to seek medical attention to determine if uterine polyps may be the cause.
Endometrial atrophy.
Endometrial atrophy refers to the thinning of the uterine lining that commonly occurs during menopause. However, it can also affect women of any age, especially those with hormonal imbalances. This thinning of the uterine lining can result in irregular bleeding, including postmenstrual bleeding. If you're experiencing postmenstrual bleeding and are over the age of 45, it's recommended to consult a healthcare provider to rule out endometrial atrophy or other potential causes. And there you have it, a breakdown of some of the common causes of postmenstrual bleeding. Remember, if you're experiencing postmenstrual bleeding or any other abnormal bleeding patterns, it's always best to consult a healthcare professional. They can provide a proper diagnosis and recommend appropriate treatment options tailored to your specific needs. We hope this video has been informative and helpful. Thanks for watching, and don't forget to like and subscribe for more content.